Facing a potential cancer diagnosis can be overwhelming. Okay, I know that's the understatement of the year. Many doctors insist on waiting for all test results before making an official diagnosis. This can result in a very long and anxiety-ridden waiting period. I know that it did for me. Now, I can't tell you not to worry because that would be just absurd. But the silver lining is that there are tools to help. Begin by breathing. I know this sounds easy, but when you're facing a potential diagnosis, breathing actually takes a whole lot of work. Prior to any test or procedure, have the technician explain exactly what is going to happen in detail. Anytime you go to a doctor's office for an important meeting, always take a level-headed, clear-thinking person. The person will not only be another set of ears, but will also support you during this difficult experience. At your appointments, it's very important for you or a friend to take as detailed notes as possible. You see, typically, people only hear a small portion of what is said in these meetings. The benefit of taking notes, in addition to accumulating valuable information, is that it slows conversation and allows you to clarify information. You can also digitally record your appointments. Ask questions. Don't be shy or embarrassed. This is your body. There is no such thing as a dumb question. Laugh at the absurd. Go ahead. Humor is a very effective coping tool, even when laughter comes at seemingly awkward times. If you sense that something is wrong, then pursue it. Trust your instinct and intuition. No one knows your body better than you. Do not make any rash decisions. Despite your feeling as if a bomb has hit you, most of the time the situation is not an emergency. You have the time to understand the meaning and process the emotions of your diagnosis. Next, learn everything you possibly can about your type of cancer. However, resist the urge to blindly search the internet for information. Instead, ask your healthcare team for trusted resources to understand your disease and then begin to consider your treatment options. Determine the best way for you to communicate with friends, family, and work colleagues about your diagnosis and upcoming treatment. Now is the time when you get to call the shots. You determine what is best for you. Begin building your own comprehensive medical record. Did you know that you legally own your medical records? You do. At the time of every test, request a copy of the results and also request the progress notes written by nurses and physicians. Hospitals and clinics do have the right to charge you for these records, but it is well worth the investment. It is also helpful to take your medical record to each appointment. Please believe that you can do this, and above all else, you are not alone.